Good morning, colleagues. And let me say just how great it is to be able to talk to you on this, your third and final day after quite a number of deliberations. And I'm really hoping that we shared quite a lot. There's been a lot of collaboration and that you will actually be able to keep in touch with each other. Let me say, I'm greeting you from cold Botswana. And I will be talking about climate change as part of what nurses need to be get involved in. Because guess what? It's very cold right here right now. It's minus 6 degrees centigrade. You know, when we say global warming, it actually is Africa freezing, especially Southern Africa. And of course, we don't have the buildings or anything for that. So it's a real problem. From here, I'm going to be wearing a little blanket just to keep myself warm. But it's also great to be with you. My only regret, of course, is that, I'm not there with you. But guess what? We did say that nurses need to be advocates. Well, this advocate is actually going to be participating in the Commonwealth Heads of Government meeting in Kigali, Rwanda. And this meeting is on malaria and neglected tropical diseases. So it's really great because if you look at my all those credentials right now, you see a lot of former UNAIDS director, former minister of health. That shows you I'm at the age where I can say anything and get away with it. So who then is better suited to go and talk to these heads of state and be able to show them that they are not doing a lot, to show them what they need to do in order to step up and really stop the epidemics of tuberculosis, HIV, and malaria. Malaria is still devastating our continent. In fact, last year, we had about 680,000 deaths, and most of these were among children under the age of 5 years old. So it is really time for our leaders to do something, and it is this nurse advocate that is going to be there to chair that session and make them come up with real concrete solutions. And I'm hoping that those of you who are from Commonwealth countries will then be able to say, let's see what they decided on, and let's hold them accountable for that. So anyway, for now, I'm going to be talking to you about nurse leaders for global health equity. And let me have the next slide, please. Well, the main goal is really to share with you and discuss nursing research. I know Sigma is really for nursing research, collaborative nursing research. So we need nursing research in addressing the social determinants of health. And these have been defined by WHO as conditions in which people are born, they grow, live, work, and age. So we're looking at this nationally as well as globally. We'll also identify aspects of leadership in primary healthcare and universal health coverage, and really looking at how do we come up with gendered policy reforms and really improving access to health for all the inhabitants of the earth, leaving no one behind. And of course, I will share my own experiences as a nurse leader who's been involved in my mission to improve global health through collaboration, collaborative research, education, advocacy, and policy change, especially policy change. Next slide, please. Okay, so let's look at the global social determinants of family and societal health. Now, if you look at these, they are really the ones that determine how people access health. And they determine what is happening right now in the global health arena. So that when we talk about global health equity, it's really saying, how do we address this in such a way that we can collaborate and ensure that what happens in one part of the world doesn't necessarily affect the other parts of the world adversely. Now, there are universal ones: gender, ethnicity, education, your employment status, the income level, housing, and of course, access to sanitation and everything. These are the determinants in every one country. We know that women sometimes are the ones that are marginalized when it comes to accessing health. But there are times when it is men who are marginalized. For example, if you look at the COVID pandemic right now, and you look at the number of people who are dying, guess what? Males are the ones who are more likely to die of that than females. Why? Because we have schooled our men into thinking that being sick is not masculine. And therefore, they tend to stay home and maybe even resort to other remedies rather than going to the hospital or the healthcare center to get help. So by the time they get there, it's actually already late. So, okay, we have that. We have the global emergencies, the effects of climate change. As I was telling you that here in Africa, we are now freezing. There's nothing like global warming. We're talking the earthquakes, we have floods, we have degradation of water and land resources, and of course, famine and unexpected adverse weather, the very one that I'm talking about. Like if right now, in fact, yesterday it was snowing in Lesotho, in Southern Africa, and in parts of South Africa. So that what does it say then? How do you ensure that the buildings, the houses are insulated, for further, dealing with such adverse effects? It's not easy. It means really advocacy, and the nurses themselves are usually the ones in the forefront and really seeing the effects of these adverse weather conditions that are unexpected on human beings. We have the man-made disasters, and these ones are actually made by people who wear trousers. Look at what's happening in the world now, the conflicts, the wars, and resulting in refugee crisis. So it is really the nurses most of the time who have to deal with access to healthcare by a lot of these refugees. So it's really something that we need to be able to look at. And we have the regulars, the epidemics of HIV, Ebola, SARS, Zika, COVID-19. COVID-19, came at a time when we were actually ready to celebrate nurses throughout the world. It affected a lot of us. A lot of our own people passed away because of COVID. But you know what? The spotlight of the world also shone upon us, and it showed nurses as that formidable force that can take care of humanity in all crises. Believe me, the status and profile of nursing will never be the same again, because now people actually appreciate the fact that we have nurses from community level all the way to hospital level. We have the global inequity, vaccine hoarding and vaccine apartheid that some of us have witnessed, where we saw the Western world, immunize their own citizens and even reach almost 100% vaccination and even have boosters when the rest of the world was still right there waiting for vaccines. I know my own country actually had long paid for vaccines, but guess what? We had to wait until the manufacturers, the whatevers, decided that, okay, now it is time for Africa. And indeed, I myself, I only got my booster dose maybe a month ago, because I had to give way for the elderly and the other people who needed the vaccines more. So that we are still at 3% vaccination rates. Countries like Botswana, which have fewer people, are at 60-something%. But that just shows that kind of inequity, where nurses themselves can be the ones to say, look, this has to stop. We need a people's vaccine that is available to everybody, everywhere, with no exception. We have the lack of protection of the human rights of the vulnerable groups, such as men, women, key populations, to the point where right now, I'm sure if I said to some of you, men who have sex with men, sex workers, it's almost like you want to put, into your ears to say, what is that? But they are there. And sometimes they suffer a lot of discrimination, especially even in our own healthcare settings. So we need to care for the elderly, for the indigenous people, for the migrants, prisoners, and people living with disability. Last but not least, the one that really, is really ours, the human resources for health. That kind of shortage. We know that right now we have more than 6 million nurses and midwives. That's throughout the world. That's a real shortage that I'm hoping that in your collaboration can be able to say, how do we then collaborate in the education and training of nurses and midwives in such a way that we can be able to export to other countries, rather than where a more powerful country comes and builds a tent in a less powerful country and actually recruits so unethically that now it takes away everything that's related to health for the giving country. So we're hoping that the WHO ethical code for recruitment can be applied, but at the same time, we need to be able to collaborate in really ensuring that we have global health equity, even in human resources for health. Let me have the next slide, please. Okay, the solution actually for me has always been primary health care. And, this was done in it was liberated and agreed upon in 1978. But, it is as relevant now as it was 44 years ago when it was done. And it was renewed in Astana in 2010, but is very relevant and is talking of acceptable, affordable, and universal health coverage. At that time, the emphasis was on maternal, neonatal, and child health, but now the emphasis is also on mental, health and well-being, making sure that we get rid of neglected tropical diseases, and really looking at epidemics in general. The great part about primary healthcare is it emphasizes community participation, because without communities, we really cannot do a lot. You can do all the research you want, but if that research doesn't then get grounded to what's available at community level, then it is actually exactly that, research for its own sake, but not to improve the lives of people. So primary healthcare, it cater for the vulnerable, the neglected groups, older adults, and indeed key populations and indigenous people. And in Botswana, my own country, even before primary healthcare, we had that concept of healthcare for all, to the point where when Alma Ata came in 1978, it was like, okay, now this we know. It was exactly that, primary healthcare, care by nurses, midwives, and primary healthcare workers. Because for us, we actually didn't have any doctors. Most of the doctors were actually from London, older men from London. So we had to start our own training of medical doctors, but that came like much later when I was now a minister. Before, we used to send people out there to Ireland, and a lot of our medical doctors were trained, educated in Ireland, but there were very few. So that really our care was by nurses, by midwives, and primary healthcare workers. And I got involved. This was a great success. I got involved and interested from the human rights and gender perspective. So let's see the next slide, please. Now, let's see, what have I learned from research in primary healthcare? As I say, I have been involved in it since I was a student a long time ago. But one thing that I've learned is that health is made in the home and in the community. Hospitals are for repairs. So we need to generate a lot of knowledge where we can be able to say, how do we ensure, promotion of health and prevention of disease at family and community level. So for me, I was able to generate knowledge power through research, and documented the impact of HIV on women. And this, of course, led to community activism, where we then had programs by and for women. So we were the first to really document the impact that women can be able to have in ensuring that we have HIV prevention at community level. Not only that, but HIV prevention, caring and support especially for mental health of people living with HIV and AIDS. So as educator and WHO coordinating director, I was able to disseminate that knowledge and influence, and really to ensure that I influence change. And I was able to educate advanced practice nurses from most of Africa, especially Southern Africa. The great part was later when I became a minister, these very nurses were the ones who then became AIDS coordinators. What happened was we decided that health is not the only one that's responsible for HIV. Therefore, every ministry, whether it's agriculture, finance, it had to be involved in HIV education for its own staff, but also for its extension workers. And indeed, guess who was already there with master's degrees in HIV prevention? The nurses. So we had coordinators, very powerful, who were almost at secretary level. And it was really great to be able to have them. For me, it became a real plus in that they became my coordinators, and I could be able to just reach on the phone and say, listen, there, agriculture, what's happening to the extension workers? Is it, are you going to collaborate with us at health? Or when do we organize this workshop? So it was really great. But the great part was simply that we were also able to document community-based interventions by advanced practice nurses in HIV prevention, treatment, care, and support. Now, their success, I was able to share with other ministers because I then became the chairperson of the African Union Ministers of Health. And let me show you the results of that sharing. Let me have the next slide. Okay, the one thing that I learned, of course, also is that health is a political choice. We need research to influence political leaders for evidence-informed decision-making and for advocacy, so that when we follow up, we know what we are following up. Now, at independence, our own country had no personnel, as I've already stated, but our belief in health for all led to the development and investment in the nursing workforce. So in particular, we're having more specialist nurses, in fact, neonatal community, adult health, name it. And we're able to strengthen even midwifery services for health promotion and disease prevention. But the great behind it all was really the free primary healthcare services, where we were able to influence government to say, in a society where people are basically poor, let's have free healthcare so that people can access health services. And this became a great tool against HIV and AIDS when the pandemic now started in 1985. So we have family nurse practitioner roles in prevention, in treatment, in care. They were the ones who were really doing everything: prevention, prescribing, patient education. And the result was that, for example, mother-to-child transmission of HIV, we dropped it down from 29% to 8% within 4 years. And within those 4 years, we were able to have 80% people living with HIV accessing ARVs, and we saw the deaths just go down. So this was really great because it showed that when nurses lead, a lot of things can happen. And I shared this with other health ministers, and let me show again the results of that sharing. Okay, so we were able to have quite a number of African countries then also educate and train advanced practice nursing nurses. So that if you look now, 74% of the countries in Africa have advanced nursing practice roles compared to only 53% globally. So this is really effective for collaboration and partnerships in academic as well as practice settings, especially when we are talking universal health coverage. We've been able to have strategic information, on how we integrate human rights issues and gender issues in curriculum planning, design and evaluation. And already right now, we do have a solid group of advanced practice nurses who are actually collaborating to address some of the areas in education and in practice to really see if we can have supportive policies, legislation, potential barriers, and also what success we can have so that we end up with that evidence-based decision-making for the continent of Africa. Let me have the next slide. And the last thing that I learned from primary healthcare is that global health equity is for the future of humanity. The experiences of the COVID-19 pandemic, I've already talked about them, but they also highlighted our oneness, our interconnectedness as human beings. In short, COVID-19, that the silver lining in that, it has shown us that we are branches of the same trees, and we are leaves of the same branches. What happens to one is likely to happen to the other. So there is need for global cooperation among world leaders and the health community so that we ensure that we have a safe environment for everybody. No country is safe until every country is safe. Now, for vaccine equity and apartheid, we need nurses and midwives to be the ones to advocate for universal health coverage so that that highest attainable standard of physical, social, and mental well-being becomes a fundamental right of every human being everywhere, with no exception. We need strong community ownerships that involve civil society, faith-based organizations, traditional leaders, and traditional healers where, they are applicable in our situations. So let's get to the next one. Next slide, please. We need to harness the power of proper collaborative international research. And I know that one you've already talked about in the past 2 days, but we also need to address those inequities of race and gender, especially when we consider that we, the nurses, are mostly the women. So this has direct impact on our health, and we need, therefore, to advocate for that gender equality that our leaders committed to. Not only that, we need to look at the instruments. Right now, I'm telling you, I'm going to the Commonwealth leaders. These are heads of state. They are going to commit to something. Now, I always say to nurses, when they meet, when these leaders meet, see what they have committed to, and ensure that you are in there to hold them accountable to say, you said by such and such a day, you'll be having this. How is progress? And that's the only way we can be able to really achieve universal health coverage. So, but all this need, therefore, highlight the need to invest in nursing, especially advanced practice nursing. And it is possible by and for nurses because we have that lived experience for innovative leadership at local and at global level. And this, of course, is what the gist of the Nursing Now Global campaign was all about. You all know about the campaign, but I will highlight just a few aspects of it. So let's have the next slide, please. Okay, this campaign started in 2018, and it was run in collaboration with WHO and the International Council of Nurses. And, in case some people are not aware, there's the website. But I know I was able to come to quite a few European countries to be able to assist launch Nursing Now campaign just before the advent of COVID-19. But the aim of this was really to improve global health by raising the status and profile of nursing and midwifery and ensuring that we maximize the nurses' contribution to universal health access, universal health coverage. And the advocacy was by the nurses themselves, but the idea was that nurses are a key part of the solution to today's and tomorrow's health challenges, but they need to be properly deployed, they need to be properly valued, and they need to be properly involved in decision making. Now, the outcomes have really been great. A lot of countries have stepped up their game, especially after we showed them the state of the World Nursing Report that puts where countries are in terms of the nursing, human resource aspect. But we saw involvement of citizens, the nursing communities, and political leaders, especially ministers of health and other public health ministers, because they were all for one goal, and this goal was really for universal health coverage, improving health for everybody. And indeed, we are hoping that this will go on, but we do have champions that will ensure that it goes on. Let me share with you two of the champions. Next slide. Here is one champion, and I'm actually really happy that he was able to be re-elected. So we have him for the next for 5 years. So that's really great. If there's one person who is committed to nursing and midwifery, it is this one. But he is really saying that we need to ensure that we educate more nurses and midwives because there is a shortfall, and we will not be able to achieve or sustain universal health coverage by 2030. That one, actually, I don't know if we'll reach it unless we do a miracle. But I'm hoping that as you all meet right now, that miracle, you're all saying, how do we collaborate and ensure that we increase our numbers? So let's see the next slide. Another champion that I like very much, and this one is really talking more on political empowerment. We need nurses that are educated, supportive, and we know they will reduce poverty. They will lower HIV infection rates and other rates, but not most important, they will lead political change. And on this one, I want to encourage any of you who just feel like, look, I want to be involved in politics, to be right there. I want to encourage you to take that mantle and say, I want to stand for office, especially you, the females, because believe me, there is a shortage of good politicians out there. We are having an epidemic of bad leaders. And indeed, maybe it is now time women take over. If we really want to change the world, it is time for us to take over. So if out there you are really burning to go for it, we will support you by all means. Maybe I'll consider going for it, but no, I'm still fighting the epidemics of TB, HIV, and malaria globally. So that will take a while. I can't concentrate on just one country. But if you want to concentrate on your country, I'll be right there for you. Let me have the next slide. Okay, so the Nursing Now Challenge is the Nursing Now campaign actually now became the Nursing Now Challenge when we ended last year. So that in June 2021, the Nursing Now Challenge we had every intention to say we are going to create leadership development opportunities for over 100,000 nurses and midwives in more than 150 countries by the end of 2022. So it's really now focusing and investing on the future of nursing. And I know in some of your deliberations, you talked about sustaining nursing. And these are the very people on how we can sustain nursing and make sure that our leaders come as young people and they develop and become, by the time they get to be my age, they're not saying, oh, what should we do? They say, I am doing this, and that's it. Let me have the next slide. They're still talking about the Nursing Now Challenge. is really to raise the profile, power, and potential of student and early career nurses globally. So it's really engaging the employers, the colleges to support leadership capacity building and ensure that these, young people are schooled. They developed on, clinical skills, and they become real leaders in whatever it is they're doing. So especially when we consider the Sustainable Development Goals, a lot of us, when we came to Sustainable Development Goals, we are focusing more on Goal 3, health and well-being. But guess what? Nursing matters in all the 17 Sustainable Development Goals. So that I'm seeing where now a lot of these youngsters, as they come in, some are saying, I'm going to focus on life underwater, and, under the sea. And indeed, they are making sure that we have good sanitation, good water reticulation. So if it's a nest, all the better in there. And indeed, they can even ensure that we eat fish that are lead-free, that are free from contamination. So I say to nurses, all the 17 goals are yours. If you feel you belong in one of them, get in there and represent that nursing career, and I know you'll do great. And it's really, the challenge is now creating that global network of support and ensuring that we have partnerships to amplify best practices and to also share them, because sometimes, we have those best practices, but if you don't share them, then it really doesn't matter. The next slide. Okay, so the Nursing Now Challenge is really that opportunity to develop self-awareness among young nurses and midwives, and to have networking, to have exclusive mentoring. And it is also an opportunity to showcase innovative, ideas through, the Global Solutions Initiative, and to engage with a supportive community of midwives and nurses in building a really great, professional network. So I'm hoping that those of you who have joined the Nursing Now Challenge can be able to share with others, to say how you are doing it, and the results, that the outcomes that you are seeing in terms of having these young people being really trained, being really developed as leaders, future leaders for sustainable development. Let me have the next slide, please. And the last slide is ready to show you how you can support the Nursing Now Challenge. So it's ready to reach out to employers, to universities, to encourage them to accept the Nursing Now Challenge. You register your organization, and you host a meeting of participating organizations in your country, so that you bring together your ideas and really sharing, and to see what can be, and where a country or a locality achieves a critical mass of organizations, that are signed up, then it helps to establish platforms for employers, for universities, for colleges, and for other participants to communicate with one another, to share ideas, and to say, how do we improve, nursing leadership for global health equity? Because that's the only way we can be able to share with each other, and that's the only way we can ensure that we have more and more nurses and midwives educated and trained for global sharing, rather than where we have poaching, by the mightier countries. Let me have the last slide, please. Okay, so in conclusion, it's really to say, nurses and midwives, we are leaders. And Sigma, of course, does give us that great leadership ability. So we need to research so that we produce better data, to promote excellence, and to influence change for more innovative, cost-effective, and equitable programs. We need to collaborate with each other, locally and internationally, among ourselves, but also with other stakeholders in research and advocacy on social and other reforms. We need to strengthen our community systems for service provision, especially you, the community health nurse leaders. We need to strengthen social protection, promotion of human rights. We need rights-based societies, ending stigma and discrimination, especially in healthcare settings. We need next leaders to mentor and to motivate present and future leaders, a la Nursing Now Challenge. So that's really like a mandate. We need to do that. But the last one, the one that I like most, is really that we need political office by nurses and midwives for good governance, for health equity and commitment to the Sustainable Development Goals, especially human rights and gender-responsive policies and services. I end this with an exhortation, especially again to the females, to say, remember that very first man, Adam, when God found them naked, and he said, Adam, what have you done? You know, Adam could have given a very nice excuse, but he didn't. What did he say? He said, the woman that you gave me made me do it. Colleagues, men never spoke for us then, and they never will. If we want gendered policies that say something about ourselves, that will improve our livelihoods, we need to be there in that political arena where decisions are made. So indeed, my last word is go there. Those who feel it, go there and participate in politics. You will bring about a better world with global health equity. I thank you for your attention.